Hey there. Got a big exam on patient oxygenation breathing down your neck? Don't worry, you are in exactly the right place. This is your fast-paced, high-yield review, and we're going to lock in the key points you absolutely have to know to pass.
Okay, so here's our game plan. We're going to hit why oxygenation fails in the first place, how to spot those critical danger signs, how we actually diagnose the problem, some simple things you can do to help, the big rules for oxygen therapy, and then what your role is when things get more advanced. Let's do this.
But first, let's kick things off with a classic exam question. What is the number one early sign of hypoxia? Just let that sit in the back of your mind for a few minutes. The answer might surprise you, and trust me, it's a favorite for test writers.
First things first, to really get this stuff, you have to understand the why. You've got to know the core reasons a patient's oxygen levels might start to drop. It all starts here. The thing to realize is that this is all connected. It's not just a lung problem. Sure, you've got things like COPD or asthma, but if the heart's not pumping right, the oxygen can't get where it needs to go. If you don't have enough red blood cells because of anemia, well, there are no taxis to carry the oxygen. And don't forget, things like aging or certain meds, especially opioids, can slow the whole system right down. Okay, so we've got the why down. Now let's talk about the what. And listen up, because this is super critical. Spotting these danger signs early is a huge deal, and you can bet it's going to be all over your exam. So what are we actually looking for? The big, scary word is hypoxia. That's the technical term for when the body's cells are basically starving for oxygen. Every single sign we're about to talk about points right back to this one fundamental problem. And boom, here it is, the answer to that question I asked at the beginning. And guys, this is a massive, massive exam point, so lean in close for this one. The earliest signs of hypoxia aren't about breathing. They're about the brain. Restlessness, agitation, maybe some confusion. Why? Because your brain is an oxygen hawk. It feels the shortage first. The stuff you might think of first, like gasping for air, that actually comes later. So on a test, if they ask for the earliest sign, you're looking for that mental status change. And then there's this. Cyanosis. This is that really scary late-stage sign you absolutely cannot miss. When you see that bluish color around the lips, skin, or under the fingernails, it's a sign of severe oxygen deprivation. This is a 5-alarm fire. You have to act fast. Okay, so your spidey senses are tingling, you've seen the signs. How do we prove it? How do we get some hard data to back up what we're seeing? Let's talk about the tool you're going to use all the time. Burn this number into your brain, 95%. When you slap that little pulse oximeter on a finger, this is the number that matters. A normal, healthy SpO2 reading is going to be somewhere between 95 and 100%. If you see a number dipping below 95, that's your cue to be concerned and report it. All right, you've spotted the problem. Now what? What can you personally do to help right now? These are those first, simple actions that you can take, and you'd better believe they're popular topics for exam questions. Honestly, the easiest and fastest thing you can do is just change their position. Simply raising the head of the bed, putting them in what we call a Fowler's or semi-Fowler's position, lets gravity do the work. It helps the diaphragm drop down, which gives the lungs way more room to expand. Breathing instantly becomes easier. It sounds simple, but it's incredibly effective. But positioning isn't the only tool in your toolbox. Don't forget these 3 other big ones. Getting your patient to do some deep breathing and coughing, that helps clear out all the gunk. Pacing their activities means they don't use up all their oxygen at once. And pushing fluids, as long as it's allowed, helps thin out mucus so it's easier to get rid of. All simple, all vital.
Okay, but what happens when just sitting them up isn't cutting it? Well, that's when we get into medical oxygen. And here's something I need you to hear loud and clear. Oxygen is a drug. It's a prescription, and that means it comes with some very, very strict safety rules.
So you're going to see a few different ways we deliver this oxygen. The one you'll see the most is the nasal cannula, the little plastic prongs that sit in the nose. That's for lower amounts of oxygen. You'll also see simple face masks, and if you're in home care, you'll definitely run into oxygen concentrators, which are cool machines that just pull oxygen out of the room's air. So whenever your patient is on oxygen, I want you to run through this little mental checklist. Is the mask or cannula on right? Are you checking their skin for any sore spots, especially behind the ears or on the cheeks? Are you helping them with mouth care? Because oxygen is super drying. And always, always, always give that tubing a quick check to make sure it isn't kinked or stuck under a pillow. All right, stop what you're doing and listen. This is probably the single most important safety rule you will ever learn about oxygen. It's a huge deal for patient safety, and it's about your scope of practice. Ready? You never adjust the oxygen flow rate. That's the job of the nurse or the respiratory therapist, not you. Your job is to see something and say something, not to change the settings. And the last stop, let's talk about some of the more advanced stuff. Now, you're not going to be the one doing these procedures, but your role in supporting the team and the patient, it's absolutely crucial. This little chart here is your cheat sheet. When the team is suctioning, your job is to get the supplies ready and be a comforting presence. If your patient has an artificial airway, you're on high alert, answering call bells right away and being extra gentle with personal care. And if they're on a ventilator, your eyes and ears are the first line of defense. You watch for alarms and you report them the second they go off. Look, if your brain is full and you can only remember one thing from all of this for your exam, make it these 3 words. Your entire job when it comes to oxygenation comes down to this: observe, report, and support. You observe what's happening, you report what you see, and you support the patient and the rest of the care team. That's it. So we're going to leave you with this final thought. Everything we just talked about, it's not just about getting a good grade on your test. It's about being able to stand up for your patient. So think about it. Now that you know what to look for, how are you going to use that knowledge to be their best advocate and keep them safe? That's the real test. You've got this. Good luck.